This is Laura Martell. I am the Vice Chair of the Global Health Special Interest Group. And today I am sitting down with Jess Denniston, and we are going to be talking about her work regarding the Brocher Declaration. And I think we'll just start off by having you maybe give me a overview of the project, if you can, and then I'll interject if I have questions, if that sounds good to you.
Sure, that works. And thanks to the Global Health SIG for giving me an opportunity to chat a little bit more. I think I had three goals for the project in and of itself, which originally was a poster in the Global Health SIG reception at CSM in 2024. One was just to increase awareness around the Brocher Declaration. Another was to give kind of a case example of how Arcadia University has attempted to integrate the Brocher Declaration into its pre-existing international service learning partnerships, and inherently then just contribute to the shared learning because it is an ongoing iterative learning process. So knowing that what we've done this year is likely going to look different from what we do next year. But the project itself was, again, mostly originated by the Brocher Declaration itself, which kind of came out of a group called the Consortium of Universities for Global Health. There was another group that kind of came out of one of their conferences that realized a need for more specific guidance on ethics around short-term international engagements. And I should clarify that the Consortium of Universities for Global Health is not just specific to PT. It includes all sorts of different kinds of allied health programs, as well as other medical programs. So certainly we have the APTA Code of Ethics, we have our practice acts in our various states, and similarly other medical professions have similar codes of ethics. But the context of short-term international engagements is very specific. So the intention of the Brocher Declaration was to give guidance in that context that was, and what was contributing to that guidance was not just from one particular PT lens or medical profession lens, but from other stakeholders that might engage in short-term work, such as religiously affiliated organizations or non-governmental organizations. So I think I'll pause there first, just because the larger overview is just the Brocher Declaration itself. And I also want to pause to make sure that we answer any questions that you might have.
I mostly just want to know, when was the Brocher, I was saying it wrong, declaration developed or written?
So it was partially impacted by the pandemic. So it was technically written in 2020, which is still very recent. While the Global Health SIG has had a webinar around the Brocher Declaration, and there's also links on the Global Health SIG website to more information about the Brocher Declaration, it's still been less than 5 years old. So I'm finding that a lot of our membership, as well as folks outside of the Global Health SIG, are still interfacing with it for the first time.
And for those of you listening, maybe we can put a link to the Global Health SIG website and the Brocher Declaration on the YouTube description or something, so it's easy access while you're listening.
Yeah, absolutely. And the Brocher Declaration itself is 6 principles that have some kind of sample behaviors listed in the 2-page document. But just as a quick summary, it includes mutual partnership with bidirectional input in learning. It talks about an empowered host country with community-defined needs, sustainable programming with capacity building, compliance with all applicable laws and ethics standards, then humility, cultural sensitivity, and respect, and then lastly, accountability for all actions, which again, I think everyone would generally agree those are good things. And kind of the next step of where we're at beyond just awareness of the Brocher Declaration is the how of it. Like, how do we make sure that we're actually doing these things? And are we assessing regularly with integrity that we're doing those things? And that's kind of where the conversation is at for those who have interfaced with the Brocher Declaration for some time, and part of what I wanted to contribute to as our first attempt at integrating these principles into Arcadia University's pre-existing programs.
Great. I think that's a great segue into you explaining how you guys have integrated it, and maybe give us kind of some hard examples of what you've done in your programs.
Sure. And I'll give a little bit more background about myself, just so folks know kind of the lens that I'm coming from. So I had been a practicing clinician for about 6 years in an inpatient rehab setting. And it was during that time that I stayed connected to Arcadia University, of which I'm an alum, and contributed to service learning programs as a clinician mentor during those 6 years of practice. That kind of then opened a door that I could step into a faculty position at Arcadia, and my role is Director of Student Experiential Learning. So not necessarily classroom work as students might picture, and not necessarily clinical education work, but kind of the stuff in between. So I fill roles around domestic service learning, as well as the ongoing optimization of our international service programs, which our third-year students have an opportunity to interface with if they choose. So when our students consider participating in our service learning elective, they have to go through a pretty rigorous approval process, similar to our clinician mentors. And I'll use that as an example for the compliance with applicable laws, ethical standards, and code of conduct, which is principle number 4 of the Brocher Declaration. There's some literature that synthesizes host community perceptions around a good partnership versus a partnership that has areas of opportunity. And it talks about students' willingness to learn, and their adaptability and their interest in collaborating with the local experts. So those kinds of characteristics are ones that we want to make sure that we're instilling in our students who choose to travel, and similarly for our mentors who choose to travel as well. But similarly, our mentors also have to come with letters of recommendation. If the country that we're traveling to has a Ministry of Health infrastructure in which we can get a temporary physiotherapy license, then we go through that process. So that also includes a pretty rigorous documentation portfolio around your diploma and background checks and so on, such that we can legally and ethically provide physiotherapy services in that given country. So those are just some examples of how we're trying to stay fully compliant with the applicable laws for the delivery of physiotherapy services outside of our home country. And relatedly, the principle number 5 is the humility, cultural sensitivity, and respect. So we've developed a pretty robust pre-trip curriculum that, again, all of our students, as well as all of our clinician mentors, have to complete before they travel to country. So for example, there is content around the ethical considerations of short-term international engagements. I have found that at the outset, students perceive that because because there is a service component, that it is inherently good. And not necessarily pausing to think about the complexities and nuances and the potential harms that can come from engagement outside of someone's home country that doesn't have focus on, for example, sustainability and capacity building. So students and mentors consider the ethics of short-term engagements. They also go through some cultural training depending on the location they're traveling to. And if students are traveling to a Spanish-speaking country, they also do Spanish language classes, which again, the research shows that exposure to the language that someone may be immersing in is highly recommended, so that students can ask more thoughtful questions when they're in country, in collaboration with the interpreters that they're going to be working with. So those are just a couple examples of some of the infrastructure that we've tried that existed before, but then we created a more robust and thorough compliance program as well as curricular program in order to try to meet the behaviors that are articulated in the Brocher Declaration.
That's so cool that you guys have been able to roll that out since the Brocher Declaration came out. I'd love to know if were you also at Arcadia University before the Brocher Declaration came out? And these changes were made. I'm guessing you were part of the changes. I'd love to know like what the changes you've seen in kind of the students' perspectives before versus afterwards, and kind of their takeaways from their experiences. I'd love to hear kind of anecdotally what you've seen.
Sure. So I'll kind of clarify the timeline that I did have the opportunity to travel with Arcadia University as a student. That was in 2014. And then I started traveling regularly as a clinician mentor, starting in 2016 and through to the pandemic. And then joined as a faculty in 2021. So I have a bit of a lens from when I was a student, though that's been a bit at this point. And I will say that while I think I can speak best to my experience as a clinician mentor prior to the Brocher Declaration, because I did not participate in the student assessment post-trip, which tended to fall under the supervising faculty role. But as a clinician mentor, I did not necessarily critically think about short-term international engagements in the way that I do now. And especially in the academic world, in the clinical and in the academic world, when we put so much emphasis on constant assessment and diving deeply into what's happening in front of us, and similarly self-reflecting around where I have opportunities to improve, to elevate my patients' experience, to elevate my students' experience. I surprised myself when I realized I wasn't bringing that same kind of lens to our international engagements. That said, I have anecdotally received really good feedback from our clinician mentors who now participate in this robust pre-trip programming. One, so that they have an opportunity to interact with the partner ahead of time. They have the opportunity to interact with students ahead of time. And they also receive some framing around they receive framing around the mindfulness that could be brought equally to this international engagement as you would to the clinic or to the classroom. In terms of the student experience, I really do love when we present to them the potential harms that can come from an international engagement, and they go, oh, like I didn't even consider that the degree of complexity or all of the different systems that contribute to a positive program, and a long-lasting sustainable program. And not to say that we then present exactly how to do it, but to then, again, create mindfulness around and encourage the critical thinking when you're in a new context and in a new culture. So I guess I'll re-summarize from your initial question about my anecdotal experience. I have found that people are thinking more critically when we're engaged in country. And our outcomes would suggest from surveys from our partner as well, that has had a positive impact on our with our in-country partners. So not quite sure if that fully answered your question, but prompt me if it didn't.
No, that's perfect. My first question was kind of what are the differences you've seen from the students? And it sounds like they're just, while they're there, they're actually thinking about the impacts they're having. And then my next question was going to be what is the impact that has the in-country partners? How have they felt different about it since you guys have implemented these changes? So
So I guess the last prong of the project, so we chatted about just bringing awareness to the Brocher Declaration, and then to give a case example of how we've tried to connect the Brocher Declaration to our pre-existing programs, but also elevate our programs. The last piece was to start to formalize our assessment process, because we already had been regularly debriefing with our international partners after an in-country engagement to assess for things that went well and areas of opportunity. And we created, I'll say, a CPI adjacent survey that is structured specifically around the Brocher Declaration principles that says, here's the principle. So for example, mutual partnership with bidirectional input, again, pulled directly from the Brocher Declaration document itself. It gives sample behaviors, just like the CPI gives sample behaviors. And it asks, on a scale, how do you feel like Arcadia University and the in-country engagement contributed to this from your perspective? Do you agree? Do you not agree? And then they are offered a open text box to then elaborate further. So we went through that surveying, that additional survey process for the first time last year. We did have a 100% response rate. And though I will very specifically say that we had 5 in-country engagements. So we had 5 responses, which for us is what we're hoping for. And we got really good results from it. We had a lot of positive results to suggest that our partners, at the very minimum, agree that we are working towards and trying to live the principles that were offered through the Brocher Declaration. Now, that said, pros and cons. I learned that when I forwarded the survey to the partner and had in my mind that it would be going to exactly to the physiotherapist that we collaborated with, we found that the leadership of our partner organization would complete it. And while I think that's still really valuable input, particularly because I'm very closely collaborating with the leadership as well as our in-country partners, I really want the survey to come from our in-country partners as well. So one of the learning pieces that I took from this first iteration of surveying is to specifically ask, or if I'm in country, which is frequently the case, to be able to hand the survey to the folks across the spectrum of the partnership, and to make sure that we're capturing all of those voices and not just the voices of those who are coordinating kind of from the top.
Mm-hmm. Yeah, that seems like a good lesson learned and something that you'll be able to improve upon for next year, right?
Mm-hmm.
I guess my kind of final question is, what does the future hold? What are the next steps?
So I've been fortunate enough to have the opportunity to, as I mentioned, present this work at the Global Health reception at CSM 2024. I also recently had the opportunity to present the same work at the Move PA conference, which is the state level conference for the APTA. So I think what the future holds is continuing to have conversations and see what folks are doing in this space. I think it was Jeff Hartman who had published an article in the early 2020s about the increasing prevalence of short-term international health engagements in PT programming specifically. And we've also seen an increase in the literature around ethical considerations in this very specific context. And we still don't have, while we have, I'll call it our gold standard in the Brocher Declaration, I think we're still very far from the how of and the optimal assessment of that gold standard. And that's very much a collaborative effort. So my hope is that I have the opportunity to continue to connect with folks who are interfacing with this space in some way to continue to learn from each other. Because again, it's very much it is a complex and nuanced program that I think has a lot of positive potential, not just for our students, which the literature shows that our students usually get a good experience, but ultimately, are we really contributing to global health access, global health equity, and communities that are fully sustainable without the need or the interfacing of service learning, and it's just collaborative learning. So I just want to keep talking to people is the goal.
I love it. If you could give one piece of advice to someone who is about to take students or does take students on short-term international engagements, and they're just starting out, they've never heard of the Brocher Declaration. First of all, would you be okay if they reach out to you? But also, what piece of advice do you have for them?
I would absolutely be okay if they reached out to me. And similarly, the Global Health SIG has a contact email address on our website that you're welcome to reach out to. But I would just encourage that you approach this program in the exact same way that you would approach your clinical practice or your classroom practice, is just take a look at the literature. Because while there is not the same kind of portfolio of literature as there might be around ACL reconstruction and therapy, there is a body of literature that attempts to define best practice and may help you appreciate where the conversation currently lies. And similarly, the folks who are publishing that research also are very interested in contributing to the ongoing conversation. So just look at the literature, just like you would to make sure that you're optimizing your clinical practice and optimizing your classroom practice.
That's fantastic. Thank you so much.
Yeah, thanks for the time, Laura. I appreciate
Yeah,
it.
we really appreciate you coming on the podcast, and thanks to everyone for listening.